County Board of Commissioners. Will the clerk please call the roll?
Commissioner Shadwick.
Here.
Commissioner Sparks.
Here.
Commissioner Vidrickson.
Here.
Commissioner Weiss.
Here.
Commissioner White.
I ask that you please stand and join me in a flag salute, followed by a moment of silence. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. We now move to the public forum portion of our meeting where the citizens may speak on county government, usually limited to 3 minutes, and items that are not on today's agenda. Does anyone wish to address the commission? Seeing none, I'll bring it back to the commission for regular business. Item number 1.
Approve agenda for public forum as presented.
Mr. Chairman, I move we approve the agenda for the public forum as presented.
Second the motion.
I would like to make an addendum to that. I would like to pull item number 2 from today's agenda. I'm sorry I hadn't given you that notice. And we still don't have the minutes corrected to my satisfaction on that one. So if we could pull item number 2.
I will amend my motion to approve the public agenda for the public forum without item number 2.
Second the motion.
All right, it's been moved and seconded that we approve today's agenda minus item number 2. All those in favor say aye.
Aye.
Motion does pass. Okay, we'll move on to item number 3.
Approval of county commission minutes for July 2nd, 2019.
Mr. Chairman, I move we accept the county commission minutes of July 2nd, 2019 as presented.
Second the motion.
Been moved and seconded that we approve the county minutes of July 2nd, 2019. All those in favor say aye.
Aye.
Opposed, same sign. Motion carries. Item number 4.
Approval of county commission minutes for July 9th, 2019.
Mr. Chairman, I move we accept the county commission minutes of July 9th, 2019 as presented.
Second the motion.
Moved and seconded that we approve the minutes for July 9th, 2019. All those in favor say aye.
Aye.
Opposed, same sign. Motion carries. Item number 5.
Approval of county commission minutes for July 16th, 2019.
Mr. Chairman, I move we accept the county commission minutes of July 16th, 2019 as presented.
Second the motion.
Moved and seconded that we approve county commission minutes July 16th, 2019. All in favor say aye.
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 Motion does carry. We'll move on to real business here. Item number 6.
Policy number 40.27A, use and possession of alcohol and drugs. Marilyn Lamer, Human Resources Director.
Good morning, Marilyn.
Good morning, Commissioners. We have 3 policies. This is the first of them that we're requesting approval of. The use of possession of alcohol and drugs. It's basically adding in a line about the use of CBD oil, that it cannot be used as a medical excuse for a positive test. There are times when there could be a trace of that, THC to show up in the CBD oil, so we want to make sure that we cover that if an employee does use it, there is that chance that they could test positive.
I assume that this is something that's pretty standard within the HR industry. Any other questions, comments from the commissioners? Okay, I will look for an approval then.
Mr. Chairman, I move that we accept policy number 40. I move approve the revisions to policy 40-27 as recommended by staff.
Second.
Done with that.
It's been moved and seconded that we approve policy 40.27A, use and possession of alcohol and drugs. All those in favor say aye.
Aye.
Opposed, same sign. Motion does carry. We got through that one a little on the wavy side, but we're through it. Maybe.
Yeah.
No comment. Item number 7.
Policy number 40.27B, Saline County Drug and Alcohol Testing Policy. Marilyn Lamer, Human Resources Director.
Okay, Marilyn, don't confuse us this time. So,
This is similar in nature. This policy is specific to CDL holders, and so it brings in that same verbiage about the CBD oil.
Comments? Motion?
Mr. Chairman, I move we approve the revisions to policy 40-27B as recommended by staff.
Second the motion.
Been moved and seconded that we approve policy 40.27B, Saline County Drug and Alcohol Testing Policy. All those in favor say aye.
Aye.
Opposed, same sign. Motion carries. Item number 8.
Policy number 40.51, financial management of federal funds. Marilyn Lamer, Human Resources Director.
Okay, Marilyn.
This is a brand new policy, it's just that all employees and agents and officers of Flint County will comply with applicable federal laws and the procurement of any assets or services utilizing federal funds.
Any questions, Marilyn? Being this is a new one, I will ask if there's any public comment or questions on this, so seeing none, I'll bring it back to the commission.
Mr. Chairman, I move we approve the new policy 40-51 as recommended by staff.
Second the motion.
It has been moved and seconded that we approve policy 40.51, financial management of federal funds. All those in favor say aye.
Aye.
Aye. Opposed, same sign. Motion does carry. We'll move on to item number 9.
Human Resources Update. Marilyn Lamer, Human Resources Director.
Okay, Marilyn?
All right, workers' compensation, we had 3 injuries, no lost time. Under benefits and insurance, we are working through our big renewal right now. We had a meeting on the 12th of July. Our plan continues to run well. We did do a second premium holiday that we were planning for the month of September, and that basically provides relief to both the employees and the county by not deducting any kind of insurance premiums. Our new plan year begins October 1, and we will be doing our open enrollment meetings on September 13th. We do have some pending decisions to make, and after this meeting today, I'll talk a little bit more about that. But CBIZ, our insurance consultants, they did market our stop-loss coverage. They're also marketing possible prescription plan changes, and then we also have a couple possible plan enhancement changes that would be, it's an enhancement to it, so it's no negative effect on the employees. Under the policies, the 3 policies that you just approved, under employee update, we have 10 new hires, 4 transfers or promotions, 4 that are no longer employed, and then we are getting down in the single digits of our vacancies. We have a part-time clinic receptionist that we are currently working on filling, custodian maintenance, same thing, currently working on filling that position. Crew supervisor out at Road and Bridge. Corrections officers, we're doing well on that. The time I wrote this, it was one budgeted vacancy, but we're actually, we have employees in line to get into these positions. Upcoming tasks are filling the vacancies, continue with the insurance renewal and open enrollment meetings, we have a blood drive in August 15th. Really getting into the in-service day preparation. And then we're also continuing to identify all policies for intermittent employees that was requested. We'll do those policies recommendations at a later date.
Well, it sounds like that's good news on the part of the sheriff's office on the overhires. Did we not budget for that? Was that in 2019 that we budget? Didn't we budget for the overhires or not?
You're not budgeting for the overhires, it's just with the vacancies, those monies during that vacancy will allow us to do some overhires, so then that way, while we have people in the selection process, we can go ahead and make some job offers.
Okay, I understand. And if we were to get to that level and be overhired in those positions, if I'm not mistaken, that'll be the first time in 4 years or 3 years in this commission that's.
Once for about a week.
Well, it's a tough job over there. I mean, I think everybody recognizes that, and hopefully at some point in time we can get those jobs up to where they need to be and take care of it. So, well, thank you. Are there any other comments or questions from commissioners for HR? Hearing none, then Marilyn, thank you for the update and appreciate it. Thank you.
Thank you.
Okay, we'll move on to item number 10.
RFA number 160-19, Sunflower Adult Day Services Contract. Rosie Walder, Senior Services Director.
Good morning, Rosie.
Good morning.
Morning.
We are asking that the contract with Sunflower Adult Day Services be renewed for another year. This is for the food that they serve for their patrons Monday through Friday. County Council Mike Montoya has reviewed and approved, and not much changed in it for this year, other than we increased our price from $4.75 to $5.
And tell me, in general, I mean, is that, how far ahead do they give you the notice of how many meals they need that day? Or is it set, or?
They send a fax every single morning. It just kind of outlines what they need for that day, and then we serve it family style.
Okay, I take it then that there's not a great deal of variation. I mean, you don't have 5 one day and 50 the next, or something like that?
No, it averages probably between 10 to 15 every day.
Okay, so that, yeah, not a great big
No.
variation or a great big deal, so.
No.
Are there any other comments from commissioners or questions?
One question, Rosie. In the past, it was a problem as far as the serving trays that you had available and the portions that were being sent over.
Yeah, over-serving. Yeah,
Right.
right.
Has that been corrected?
It
Have you-
has.
Okay.
Yep.
All right. And all the meals meet their guidelines as far as health and,
Yep, they set everything out in those guidelines, and we do meet those.
okay.
Thank you.
Well, I was going to say something about the over-serving, but I better not. It pertains to Roger and I, but we'll let that go. Okay, because an RFA is involved here, is there any public comment involving the senior services contract? If not, bring it back to the commission for action.
Mr. Chairman, I move we approve the signature of the Sunflower Adult Day Services.
Second.
Been moved and seconded that we approve RFA 160-19 for the Sunflower Adult Day Services contract. All those in favor say aye.
Aye.
Aye. Opposed, same sign. The motion does carry. We'll move on to item number 11.
Pretrial stats update, Andrew Pellant, pretrial program coordinator, and Andy Grievous, community corrections director.
And good morning, Andrew, and good morning, Annie.
Thank you very much.
Thank you.
Good morning.
Good morning.
So I'm going to go over the stats for the pretrial program that we started back in April. In the month of June, we had 43 placements on pretrial services. As of June 30th, 64 are being actively supervised. We have 20 in custody. 17 have had their pretrial bond revoked, and 14 have had their charges dismissed or they have been sentenced. Of those who have been in custody on pretrial, charges and bond amounts include, I know there's always questions about the ones we have in custody. When we do our screening process, the initial point is to give the district court judges as much information as we can when they're making a decision on bond. And so some of them with some pretty serious charges, we'll still screen them because it allows us to get a chance to do some background, do some criminal history, verify residence, employment, and just get that information to the judges. These are offenders who still pose a substantial risk based on their charges and some of the other factors. So the courts, what they'll do is, with our information, they'll still place them on pretrial. They'll have a significantly high cash surety bond. But we still have them on pretrial. It's still on our books. So that's what the 20 are in custody. And just some of the charges of some of the ones that are in custody include kidnapping, robbery, battery, aggravated burglary, aggravated domestic battery. So the ones that are in custody, the majority of them have some significantly serious charges. So I was just going to just explain a little bit why some of those are in custody. Of 17 who have had their pretrial bond revoked, 3 were because of new alleged charges and 14 were failure to appears. The majority of the time on the failure to appears with the pretrial program, the courts give us an opportunity to try and locate. Instead of, if they miss their court appearance, instead of initially revoking bond and issuing a bench warrant, they'll notify pretrial services, and we'll try and use our resources and our time to try and locate them and get them back into court. And then we'll appear on the status date, and hopefully by that point we have contacted them and made arrangements for them to be in court. If we are unsuccessful and they are not in court, then that's when the district court judges will revoke the pretrial bond and issue a bench warrant.
If I'm not mistaken, I mean, that's the one charge that the public doesn't quite understand, and it drives the judges crazy, is they give these people a chance, and then they don't come to, just all they have to do is show up on time, and when they don't do that, then it's a revocation of their freedom, so to speak, and just show up. And then the public says, well, you've got all these people in jail just for failure to appear, but the judges have no choice. I mean, if they don't want to come and make their appointments, that's the issue. But that's what fills up our jail with the public perception is those people shouldn't be in jail, when in essence, there is no choice to it.
Yes.
So,
And
I just want to say that's correct. The judges have given us some leeway to look for them, and other times that they come and they may have their bond revoked or their pretrial revoked, Andrew's been able to get them back out and work with them and try to get them back on track. Also, I think Andrew will talk about it, but we're working on a system that'll be a talk to text, if I say that right, or text to talk, I don't know. That will be automatic to them. Everybody has a cell phone of some nature, and if they don't, we'll purchase a very low-level phone. But that'll also give them another notice, another opportunity. It's not just us calling them. They're getting these texts on a regular basis, letting them know. So we're hoping that'll help.
and I guess the whole point, I'll be redundant, but the perception is that the judges and the community corrections and the sheriff and the county commission just throw them back in jail for a small charge, and that's just not the case.
No.
And there are certain instances to where someone has their pretrial bond revoked and then they get picked up on their warrant, and the courts may modify the pretrial supervision and place them back on, and just modify it. They might place them on GPS monitoring. So even after that, we try to understand the barriers that prevent people from being in court. Some of the best practices of pretrial is, I know it doesn't seem like a big deal, but just calling them and reminding them of court of the time. We do that on a regular basis. I actually just made 3 phone calls this morning to remind people of court. Sometimes just that reminder is helpful with the pretrial program. We want to understand maybe transportation barriers, and so we always make it clear to our clients when they come in, if there's ever issues with transportation, you let us know. If there are issues with anything related to that, so we're always trying to understand the barriers and trying to again change the program in a way to where we're addressing all those areas as they come up. And
I think that's another thing to make the public aware of, is that your department and the judicial side of things they really are trying all kinds of things to get these people to their assigned appointment. And the judges are being lenient by even giving you another day or 24, 48 hours, whatever it is, to find these people and get them in. So they're pretty lenient, but there comes a time.
Of the 115 defendants that have been placed on pretrial supervision in April, May, and June, and a lot of these stats, and I'll go over the ones so far in July, but the ones I'm reading now are just through June 30th. They have saved the county 2,781 jail days. And speaking with the jail staff, they advise it costs $35 a day to house inmates. So far in July, 29 defendants have been placed on pretrial supervision. 20 are out of custody, which leaves 9 in custody, and then 266 jail days saved so far in the month of July. Some of the resources, I know this was went over last time, some of the resources that Community Corrections offers and pretrial is we've done drug and alcohol evaluations, which would lead to drug and alcohol treatment in some instances, including social detox and outpatient group. And what social detox is, there's different levels of drug and alcohol treatment. If it's something where they're under the influence then and there and they need immediate social detox, Central Kansas Foundation offers that service. They're able to go for detox. We do utilize some of our funds when we need to help cover that cost. And they're supervising detox under the people who need to be supervising them, again, with Central Kansas Foundation and some of the health staff that they have there. Then it can be inpatient treatment, which is anyone from 21 to 30 days of residential treatment for drug and alcohol. That can lead into outpatient, where they attend. They're not an inpatient, but they attend groups several times a week. Drug and alcohol support groups, NAAA meetings. We get them set up with over at Pathfinders at CKF, some of the recovery coaches. We do mental health intake and assessment through Central Kansas Mental Health Center. We have a behavioral health liaison that comes to our office that we utilize to try and get these set up and make sure mental health needs are addressed when they need to be addressed with certain clients. We've done temporary housing, City Go bus passes, kind of going back to the transportation thing, giving people options at transportation to get around. I've referred one to a USD 305 diploma completion program. We have in-house cognitive-based groups that we offer at community corrections at no cost to the clients. We refer out, there's organizations that help with free meals, showers, clothing, hygiene items. We have a resource list that we give every one of our clients at intake to give them that information just in case there's situations where they need to utilize those services. We utilize evidence-based practices, including motivational interviewing. One thing that I will be doing in September is I'll be attending a national pretrial conference. We're always trying to stay up to date on best practices and methods across agencies across the United States. I've found an important part of these programs, when I was in drug court, is just staying ahead of, trying to learn the best practices and what other agencies are doing, what's working, what's not working, and then incorporate that to continue to have our program move forward. Manny talked a little bit about our IT system. Setting its text-to-talk, and again, just another avenue to get people the information for court, for their office appointments, just so that information's out there and they have it. And best practices with pretrial will say that if they have that information, they're more likely to show up in court, and so that increases. And then I made a note on here that communication between local agencies is getting a lot better with the program just being new. Sometimes it's just all the agencies trying to, feel it out and see what it's about. And so our communication with the Saline County Jail is really good right now. Our communication with the county attorney's office, with the public defenders, with our local drug and alcohol agencies, our mental health agencies. We had a client recently who was recommended to complete inpatient drug and alcohol treatment, and our office communicated with court services because she had a PSI that was scheduled, a pre-sentence investigation that was needed for her sentencing. And she had inpatient treatment that was recommended, and we had a bed date. And so, but that would have pushed her out past some of these other dates with the PSI. So we coordinated with court services and the district court judges in the Saline County Attorney's Office, and we're able to get her in court, update the court on what's going on, what the status of the drug and alcohol treatment was, and we got all her PSI and her court dates rescheduled so she can go to inpatient treatment. So again, it's just the communication is when these things come up, sometimes they're crisis situations, and we try to address the crisis that needs to be addressed right away, and we just communicate with other agencies. And in this instance, everybody was great with the communication. Everybody was on board with what we were trying to do. And kind of leading in up to yesterday at 5:30 p.m., the only thing we had left to do was her transportation. She didn't have reliable transportation to get to inpatient treatment, which is in Wichita. And we were trying to utilize every option we had, including if there's a reliable family member or friend, we would give them some gift cards for gas vouchers, I guess what it's called, to try and get her to treatment. We actually coordinated with Don Green, Pathfinder. He's the head of Pathfinder at CKF, and he was already bringing a client down to Wichita for another residential, and so we coordinated with him, and actually just saw Don as I was walking out this morning to come here. He was there, and he was able to pick her up, and they're on their way to inpatient treatment right now. And so I use that as an example of just the communication right now is working really well with all the agencies, including the court, county attorneys, and public defenders.
Well, and resource sharing, I mean, it's critical. You're not going to be successful with this population of persons without sharing of resources, and so we're lucky that we've been around long enough and have our well-versed and our information out there, and we know where we need to go.
Okay, I think Andrew has communicated with you that the commission does wish for the short-term period anyway, that we do want a monthly update on this pretrial stats update type thing as this program is in its infancy, to keep us apprised of what's going on and help us make decisions regarding our jail reduction staff and all the decisions that go into our jail situation. So we do want you to continue to come on a regular basis and give us this update, at least for the near future. So thank
Yes,
you
sir.
for the update. Is there any other comments or questions from the commissioners?
Nope, thank you.
Seeing none, thank you.
All right.
We'll move on to item number 12.
RFA number 165-19, FY 2019 KDOC budget adjustments. Annie Grievous, Community Corrections Director.
Good morning, Annie.
Morning. This is just cleaning up end of the year, which ended for us in these grants, it's fiscal year, and it ended the end of June. So we are requesting permission to move a total of $33,773.11 from one line item in a grant to another line item. It doesn't change the bottom dollar. It doesn't make any difference in what we got. It just allows us to where we budgeted or we needed money in different categories to allow to move this time of year. And it's within two grants. It's one of, it's a behavioral health grant that I write, and it's also our adult intensive supervision program grants. So the state allows you to do this. It's been in front of our board. Last week they approved and signed, and now we need commission approval to move it forward to the state of Kansas. So I'll quickly go through this. Under the behavioral health grant, we had some substance abuse. We moved it over to training in the amount of $10. Substance abuse, again, over to group supplies. We moved it to we moved $458.57. From the substance abuse line item over to contractual personnel, we $3,203.80. And then substance abuse to other services, $6,521. Then under the adult supervision program budget, we moved from travel to training, $3,465.94. Under salary, we moved to equipment. No, I'm going to get out of my way. From salary to equipment, $3,000. Okay, I told you wrong. Travel to training, $343.69. Sorry. Equipment from salary, $3,465.94. From benefits to facility costs, $7,091.17. From communication to contractual, $1,711.20. From benefits over to contractual, $10,000. And then from salary line item over to contractual, $967.74 for that total of $33,773.11. Again, it doesn't change the bottom line. This is just a closeout process of the year. We move them around to fit the needs of what we saw as that last quarter was coming in. And if we get this approved and signed, it's not a problem. DOC allows us to make those changes.
Okay, and I do realize that while there is no change money-wise, $17,000, I guess I'd be remiss if I didn't ask, when we're talking $17,000 worth of benefits, how are we able to save $17,000 in benefits?
The 10,000, I think that's what you're talking about.
Well,
is
there's
the-
A7 benefits.
Oh, you added them.
Yeah.
Okay. I can tell you that we had some turnover, and when people leave, That saves some dollars while you're hiring. But also, we project early, before our year even starts. Marilyn assists us in projecting what insurance costs will be. Sometimes it's higher or lower, so that also changes. I believe we had 2 staff that didn't need insurance. And we always budget for family insurance because you don't want to cut yourself that short ever, because that's very costly. And I think that also was some savings. So those are savings that we had. It didn't, we needed the staff. It had nothing to do with not needing the staff. It was just stuff that was budgeted in a different place that staff didn't take, or there was a turnover time, those kind of things.
Okay, questions or comments from the commissioners? Is there any public comment? Seeing none, I'll bring it back to the commission for action.
Mr. Chairman, I move we approve the adjustments to the FY19 KDOC budgets as listed in RFA 165-19.
Second the motion.
It's been moved and seconded that we approve RFA 165-19, fiscal year 2019 KDOC budget adjustments. Further comments or questions? Hearing none, all those in favor say aye. Aye. Opposed, same sign. The motion does carry. Item 13.
Community Corrections update. Annie Grievous, Community Corrections Director.
Morning again.
Good morning. The caseload report stats are attached. They're an ever-growing population, but they're there for you to look at if that interests you. Under agency and staff update, we continue to serve a population that continues to grow. We're making adjustments to the existing space, and we've just been there right at about a year. We took a small conference room and made it into an office. So we had our landlord facilitated with us, bringing in a door and building that into an office. We also moved some of our intake work with our younger youth. I think we've talked about this, but some of the intakes we do and some of the work we do involves infants from newborns all the way up to 3-4-year-old toddlers. And so a better environment for them instead of the police department where we were meeting with them was in our office. So we're using a area, and it's closed so we can keep it private, but we went in and put nice carpet in and a TV, and we bought some really inexpensive iPads and movies and toys and those kind of things, because we wanted it to be a better environment when you're taking care of a small child. And we can have them for 8 hours or more at times, so it's important for us to be aware of that. The older youth that are maybe going to go to detention or be released to a family member, we still address those youth at the police department. So I keep thinking as we continue to grow and the programs go, I may be looking at knocking another wall down. Who knows? I mean, I can't wait. I got my sledgehammer. I'm going to town. So we may be into the next area with some more office space, which is good and surprising, I guess, all at the same time. We recently hired a new juvenile ISO, Alexa Tyson. She interned at our office as a graduate Kansas Wesleyan, and now we are fully staffed at this point. Under the adult grants, KDOC, our new year, fiscal year 20, began July 1st. We were fully funded in the amount of $858,164.31, which is an increase of $33,006.32, which is unheard of from the Department of Corrections on adult services, because we never meet their benchmark of the number of adults the court sends to prison. So for us to get an increase of that size when we're still struggling to meet the 75% success rate, we hang at about 69, tells me that we're doing some things right. So I was proud of staff and the work that goes on. It supports a large portion of staff, a large portion of facility and maintenance, client services, and programming. The remaining dollars to do all the rest of it come from Saline County, other grants, our reimbursement line, and the work the staff do. The Federal Justice Assistance Grant was fully funded in the amount of $66,205. It supports drug court ISO salary and benefits. As we continue to grow, Judge Johnson's made it clear that we need another drug court ISO. And so I am going to consider this grant next go-round. It becomes applicable again in August, and through October. And I may test the waters and see if they would fund two through this, because I think that Judge would really like to see some growth, continued growth, and open up some more dockets, which is a good thing. It's all positive as we continue to keep offenders out of jail and prisons. So I am considering that and looking at that and working with Judge Johnson. Our behavioral health grant was approved in the amount of $244,227.84. It's a slight reduction of $10,769 from the previous year. The decrease was in client vouchers for services, and it's very valid. They should have cut us. We did not utilize from that grant all client service voucher dollars that we had requested the previous year. And it's like a lot of grants, you use it or you lose it. And we knew going into the fourth quarter, even into the third quarter, that we weren't utilizing it as much. We reminded staff it's here, don't forget those kind of things. I think what happens is we've built such a center of one-stop shopping in our agency, plus our resource bases, plus the other grants that we write, that they have pockets all over to take the dollars that are needed. And that's great. I want that to be available. I don't ever want to tell a client no. And the client Andrew spoke about was literally us pulling dollars from different grants and able to use those dollars. So I want to do that. Because of that, though, we got a reduction. So we need to watch that better. We'll really monitor it this year and make sure that we're tapping into those dollars as it is. We changed our budget and our line items a little bit to reductions where we saw those needs, and we'll watch for that. And so the good thing about this grant is I always get the 3 staff I want, and that's critical to me. I can find other grants for services. And so they have consistently kept funding 3 staff, 2 here in my agency and 1 at CKF. The Don Green he mentioned, we pay his salary. So, and that works, and it's a delight every time I see that we didn't lose people that are so critical to the work we do. So that's a good thing. With the new governor and the new Secretary of Corrections, they changed some administrative staff at the Department of Corrections, both on the adult and juvenile side. They made great choices. I'm very excited and looking forward to the new year with them. And I don't usually say that, so that's new. And then same thing under the, as I outlined in the adult budget, same thing under the juvenile budget. New leadership will definitely change, and it's good for the entire state. The juvenile side is not nearly as progressive as the adult side. They're less inclined to adopt evidence-based practices and efforts. So we've always just had to do those things ourselves and invest in the training for our juvenile staff like we do with our adult staff, even though a lot of agencies tend not to do that. They separate and wait for the dollars or DOC to step up. It makes no sense to me. We're all in the same unit. We're doing the same work. Let's be on the same page. So that's what we did, and we have a lot of long-term staff there, and so it makes sense. The application for the new year, FY20, was fully approved in the amount of $738,624.01. They support juvenile staff, a portion of facility and maintenance, client services, whatnot. We also write a prevention grant that we support with CAPS. It was fully funded in the amount of $38,697.52, and that supports our Spanish-speaking program and our court system and going in the home, and that is very, very positive and very good, and the judges are very pleased with the fact that we are able to provide those interpreters and in-home services. And then we also received the reinvestment grant at full funding at $157,253. It supports staff and programming and services with the youth that are on probation or on diversion or any place with our services, but also court services. We do those activities through CAPS. So we write the grant, I write the grant, and then we bring in our youth, but also court services youth, and we allow the community to utilize the services at no cost to them. We make sure it's all covered in the grant. And I always am grateful for CAPS and their willingness to step up. Currently, I'm working on a Dane Hansen grant application for voucher funds to support mental health for clients and family. I'd like to target drug court and pretrial population. We're seeing the needs more and more in both those populations, and a lot of clients are unable to pay the services. Mental health services are on the increase, as we've talked about this for months. Local agencies have not been effective, be able to provide effective services due to their lack of funds also, and the client's inability to pay. This agency, I approve thousands of dollars to the mental health center just to get the client in because they owe $30 or on a back bill that might be 2-3 years old. It could be less than that. But mental health center, and I know they're a business, they won't see them. But I've got a crisis going here that the client needs meds and needs to be seen, and so Community Corrections covers that cost to get them in the front door. And that's fine. The problem is that with the delay in us learning about the client not able to get in and why is what bothers me. I need to set up a system with the mental health center where they automatically make a call to us, because 100% of the time I'm going to fund it. Now, I may go back and find out what's going on with that client and why that client didn't pay that bill, but if they're at a crisis place or they need a med check, we don't need to mess around with that. I've told the story a bunch of times where a client came out, hadn't had a med check, hadn't done anything, he'd been in jail, and we know that they lose their medical cards, everything goes, you have to re-up it all, and I ended up paying, $3,000, $4,000, $5,000 at B&K. Because he had 10 meds. And it wasn't a choice. He came in our office, he's a great person, he does well, but he couldn't get himself together. So we're going to do those things, and I'll continue to do those things, but if I can find some grants to maybe roll over to those services and avoid the delay of the payment and get those clients services much sooner, it also will reduce recidivism and crime and all the things we're working to do. So I'm doing that. The application's due August 15th. Additionally, I'm going to apply for the Saline County alcohol tax dollars for pretrial. There's very little dollars there. I used to apply all the time. I quit because it's a small amount. There's not enough bars outside the city limits. Someone needs to open a bar outside the city limits. So we're still going to apply, though, and if we can get just a little bit, we'll put it towards our pretrial clients, so Community Corrections isn't constantly shelling out those dollars and allow them. And it could be a win for the county. If you give me a little dollars there, you can not give me so much next time I come a begging. And then in the fall, the city opens theirs, which is huge, their alcohol tax application, as you all know, and I will be applying for those. We did reach out to the city. I think it's on a 2-year cycle, so the second year was just automatic, so I'm hoping that in October we receive the new application and can apply. And again, I'll apply those dollars to drug court and pretrial. We've written many Women Helping Women grants through the Saline County Greater Foundation. That foundation has a quarterly application process, and one of the ones we've tapped into many times is Women Helping Women. You can apply for a max of $750. We always apply for the max, and we always get it, and everything that's done with those dollars is received by women to go to the dental. We've received dentures, dental repairs, extractions, everything that they need to feel confident and secure, and, and gives it to them with that. And so we're happy to write those grants. Michelle Stevenson and I are kind of the ones in the agency to put those out, and we try to do 2 or 3 a quarter. And one of the things I say is that these are clients that are no longer using drugs. They're successful in all the programming. We don't just do it for anybody. They've proven themselves. And some clients will be able to give 100 or 2 to the process, and that's great too. But when you turn the picture of someone that has no self-confidence into some confidence, you grow them, and they're able then to continue to grow. So those are important. And then I'm also going to do a federal national drug court grant. That also could be an area I could get another staff member unfortunately, they like to come in and study your program and provide technical assistance and quality assurance audits, and that's all good and fine, but we really feel very confident in what we've done. And Judge just got back from national training, and he said, I think we're one of the best. He goes, I can't imagine the problems people are having that we don't even see. So I give that to the credit of the court and the judges. But, so I'm looking at that. It's a big chunk of money. It would be nice. At the same time, I don't want staff overwhelmed doing things that aren't necessary. So we'll see. We'll see. That wouldn't hurt us. But, and then, we had a board meeting. We meet every other month. We address all the issues. I have contact with our chair on a regular basis, Todd Heitschmidt, and we always have an education piece. We met on July 18th. We reviewed the current grants, modifications to the budgets. I talked about the grants I'm going to apply for, and Kelly Mowbray from Partners for Success provided the education piece. Drug court, been in existence since 2013. Funding comes from Saline County Community Corrections and a federal grant. Total number of graduates is 112. Currently, it holds a 94% success rate with the UA testings negative, a retention rate at 80%, keeping all the clients within the programs and active, and the new drug convictions are amazingly low at 8%. So 8% of the graduates since 2013 have committed another drug offense. So that's extremely low. We're higher on the good sides than national level, and we're lower on the side you don't want to be high than the national. So we have a 90% success rate. Probably unheard of with this severe population of clients, but again, I give credit to the staff and the judge and doing those kind of things. And I mentioned they just all got back from a training in Washington, D.C. And Andrew gave you the information on pretrial.
All right, thank you. Any other comments or questions from commissioners?
No.
Okay, well, thank you, Mrs. Greaves.
Great job.
Thanks.
All right, we'll move on to item number 14.
RFA number 162-19, Ellsworth County Letter of Understanding. Jason Tiller, Health Department Director.
Good morning, Jason.
Good morning, Commissioners. So today, for this one, we have, since 2010, we've provided registered dietitian services to the Ellsworth WIC program using one of our dietitians for 2 days a month, total of 16 labor hours. As they don't have a registered dietitian, nor do they have a workload that will support hiring one. Lincoln County has, since this started, way back then, has been the parent organization of Ellsworth.
Your speaker must not be on.
There you go.
Lincoln County has been the parent organization. This is the way it was arranged about a decade ago. And so what this letter does is it just updates those terms of what services we are providing for Ellsworth County. There are no travel costs involved, as the dietitian that provides these services resides in Ellsworth. And the cost for those labor hours are already covered under our WIC grant from the state. So alternatives, of course, sign the letter and continue the services, send back for more information, or don't sign. We would recommend that the chair sign this letter and continue our longstanding partnership between these counties. Of course, this has no impact on the budget.
I see no reason why we couldn't continue to do so then. So I will stand for the other commissioners to ask you questions or comments.
I don't understand. It seems kind of convoluted that Lincoln County oversees Ellsworth County's health department.
They oversee their WIC program.
I see, okay.
So Ellsworth County has some administrative staff that does the administrative task of the WIC program. Lincoln County handles all of their financial affidavits. And we had talked to the state WIC program, and they wanted to leave it set up like that. Mm-hmm. And then we provide the registered dietitian functions for that 2 days a month.
All right, is there any public comment? Does Seeing none, I'll bring it back to the commission for action.
Mr. Chairman, I move we approve by signature the Ellsworth County Letter of Understanding.
Second.
Been moved and seconded that we approve RFA 162-19 Ellsworth County Letter of Understanding for the Health Department. All those in favor say aye.
Aye.
Opposed, same sign. The motion does carry. All right, we'll move on to item number 15.
RFA number 163-19, KDHE Aid to Local Program Universal Contract. Jason Tiller, Health Department Director.
Again, good morning, Jason.
Good morning again. So these are our annual aid to local contracts for the grants that we receive from KDHE. The overall contract is called the Universal Contract. That just outlines the overall responsibilities, basically of accepting the funds, using the funds, penalties for misuse of the funds, that kind of stuff. And then there are two supplemental contracts to that main contract. They call them as contract attachments. One of them is for state formula, which is a population-based funding that's received. Each county gets a base of $7,000, and then above that, based off their population numbers, they receive additional funds. This year, for that grant, we get $37,006. And then the other supplemental contract attachment number 3 is for public health emergency preparedness, and that one is for $37,637. And I have, these grants require 2 original signed contracts, and I have 2 copies that are already tabbed for the chairman's signature. Because then we send those to the state, secretary signs off on them, and then we get an original copy back for our files with all original signatures. So alternatives, sign the contracts, continue the operations that these grants help support. Send this back for more information, or don't sign the contracts. I should also mention that the county counselor has reviewed these contracts and has no issue. We recommend signing these contracts and continue the operations and services that these grants help fund.
Okay, once again, I don't have any issues with signing those documents, so any other comments from the commissioners or questions? Not, I'll entertain a motion.
Mr. Chairman, I move we approve by signature the aid to local contract to accept grant funding.
Second the motion.
It's been moved and seconded that we approve RFA 163-19 KDHE Aid to Local Program Universal Contract. Before I ask for a vote, I should ask for public comment if there is any. Seeing none, all those in favor of the motion say aye.
Aye.
Aye. Opposed, same sign. Motion does carry. Item number 16.
Health Department update. Jason Tiller, Health Department Director.
And good morning again, Jason.
And once again, don't be afraid of all the slides. There is some redundancy since it has been 6 months. This is just to keep you updated. Just waiting on the projector. All right, so this is your mid-year update. Again, anybody can connect with us in multiple ways through social media and online, as well as coming to our office or calling us. As a refresher, our mission and vision statements, which you have. Within our leadership team, we will have some changes this year, and I will go into those when we get in those specific programs. All right, child care licensing. This year, child care licensing as a profession in Kansas is celebrating 100 years of being in existence. A couple things that they've had this past 6 months. One of them is during the Child Care Provider Appreciation that was back in May. They had placed banners in McPherson, Saline, and Ottawa counties just to raise awareness and remind people to think they're child care providers, since they're the ones having to, or taking care of their kids for, a good part of the week so that they can work and so forth. Also, during the week of the young child, they had a table at the health department, and they had different themes of it each day, different little giveaway things, just to be part of that annual event. And you have the statistics for their visits. Remember, these do cover 3 counties for McPherson, Saline, and Ottawa. Maternal child health. So far this year, they've had 547 people participate in the Becoming a Mom program. There was the special health care needs site visit from KDHE, and there were no issues annotated during that site visit. And this year, they had the 4th annual Saline County Safe Sleep Community Baby Shower. It's expanded its scope a little bit besides just being a community baby shower with multiple agencies that were involved in the prenatal and postnatal events. They also have expanded a little more with a focus on safe sleep as well and prevention of SIDS. And they had 146 participants for that. And the clicker.
Phil, I think is the mouse on this screen, because if you switch to that screen, the clicker won't work.
There we go. Thank you. And you can see here the MCH visits for the last 6 months. In clinic, one of the updates there is that we've had one secretary that retired earlier this year, and so we've had some staff transition where the part-time secretary applied for and became the full-time, and we just finished interviews for the part-time secretary yesterday. We had the CLIA survey, which I believe is Clinical Laboratory Inspection Agency, which regulates all labs, and since we do draw blood and process laboratory specimens to be sent to KDHE, that has to be completed, I believe, annually, and that was done just recently, and there was no issues. And the Vaccine for Children program had a site visit from KDHE, and there were no deficiencies noted there. Just upcoming, we do have the community flu clinic in October. That information will be coming out soon. We have a family planning site visit from KDHE in November, and Joyce Shoemaker, our longtime clinic coordinator, will be retiring later this year as well. So we'll be searching for her replacement here starting in the next couple of months. And you can see by this graph the types of visits and how many we've had over the last 6 months.
What does that number, do you have that, Jason, in terms of the clinic visits for the 6 months of the year? No, total
That's just
number?
raw numbers, the number of visits per each of those.
So, I mean, you're talking, what, close to 2,000, a little over 2,000 visits? Would that be? I'm just.
That'd be a fair number of added up.
Yeah, 13.
And that
yeah,
does- and
probably
that-
somewhere
yeah.
around 2,000.
Yeah.
So
And that
it's-
doesn't include the disease investigations that they do and, the time that it takes for doing each of these. These are just the raw numbers.
So you're not sitting over there doing nothing.
Absolutely not. Sometimes I try to have to keep them from running away because they've got a lot going on. No, they're very busy and respect them for that because it takes a lot to, doing a lot of what they do. And for home health, they were again this year finalists for Salina Journal's Best of the Best. And then home health and clinic participated in Rosie's Senior Center Health Fair. They said they had a really good turnout over there. Got to talk to quite a few people. Clinic talked about some of their immunizations for those over 65, like Shingrix and pneumonia shot and that kind of stuff. And home health just, had information about their services. And then those are their raw numbers for this past 6 months. Wick,
Excuse me just a second.
Yes.
On the home health care portion of it, how many people are in that department?
altogether, including administrative staff, there are 10, 4 RNs, 3 aides, 1 coder, 1 biller. I think I'm forgetting. I'm sorry, 5 RNs. That's where I'm getting off of my numbers. 5 RNs, 3 aides, a coder, a biller.
Okay, thank you.
WIC, longtime coordinator, Jan Albrecht, is retiring. We have since replaced her position. And within WIC, I didn't annotate it here, but the one of the part-time positions, registered dietitian positions that we had, when Jan retires and Virginia, who will be replacing her the 1st of October, then that part-time position will then go away. But since EWIC, this is just our active caseload for the last 6 months. And it's pretty much kind of stayed roughly the same. It looks like big jumps, but it's just the way it graphs out on here. There's only maybe, I need glasses, I can't read that far. But 30 or 40 maybe, variation per month. Maybe not even that much. And again, this is just the raw visits for the last 6 months. That EBT benefits down there, that replaced what we used to show up here as check pickups. So people that either call in or it's their time to update their benefits. So that's that appointment now, where before they would come in, benefits would be verified, they have to print out their checks, all that kind of stuff. Now, a lot of it can be done over the phone, since it is the electronic system. They verify the benefits, they upload the next month. So that has taken down a lot of the staff time that it used before, which is why we, at this point, aren't projecting a need for that part-time position that we did have. So preparedness and health ed, I just want to highlight one thing. Of course, there's still a lot of standing water out there. So mosquito prevention, drain out standing water if you can. If you can't, use the mosquito pucks in the water in order to help prevent growth. Dress to protect yourself, use DEET to keep the mosquitoes away. We haven't seen, to my knowledge at this point, any active cases of anything like West Nile virus or anything like that. There was some surveillance that the state did for a 2-week period where there was a high number of the mosquitoes, but like I said, I'm not aware of any actual confirmed cases at this point. We did some training with our protective gear if we had to go into a type of hot zone area. Yes, it looks like a giant yellow marshmallow man. But there's, a process to putting that stuff on and taking it off to make sure staff are protected. So we have been doing this annually, and we'll try and I think we're going to try and go to maybe an every 6 months type of refresher training to keep up with these skills. We also identified a few things that we need to have on hand, so we're taking care of getting those shortages. So if we have to go through this process, if something like Ebola shows up again, then we are still continuously prepared for it. Academic Health Department partnerships. Right now we have a K-State student who's from the MPH program this summer who's been working with the GIS department on a project of asset mapping, which looks at where resources in the area are located as compared to the census tracts, which also shows like median income for that area, median age for that area, things like that. And we're also looking at where those resources are in relation to where the people that they are serving, including our own services, are. So are there barriers? He's also including like City Go bus stops, the new bicycle areas that the city has put out for transportation. So we're hoping to have that finished later on this summer and then really be able to kind of delve into some information and data of that may help drive some, not only stuff for us, but some of the other program areas that we're working with outside of the health department. In administration, we did have our current custodian who left to find a different job, so we've been interviewing to replace that one. One thing I did want to talk about is this systems thinking and systems intelligence. So I received a scholarship along with 2 other staff from KDHE to attend this public health improvement training in New Orleans in June. And from that, we also are working on a state-level project that's looking at behavioral health and public health in the state, and learning a lot more about that systems thinking and systems intelligence. And just to give you an idea of kind of what this entails, this is why this project that we're working on in state will really help us to practice a lot of these skills, because you can see here there's a lot of arrows and graphs and things like that, which is a little bit new for some of us, including myself, as far as thinking through a lot of these things. But I think the benefit of looking at things in a systems approach will be of an extreme benefit for us at the health department for looking at our connections and programs with other agencies and other things moving forward. Some of the couple of interesting points I'll quickly talk about. One of them is the unintended consequences effect. And when you're going through these graphs and these different archetypes and thinking through if A, B, and C, what would be the unintended consequences and what would it cause down here to the outcome that we're trying to achieve? And is that going to create basically just a loop where we're just constantly doing, the same thing over and over? Or is it going to create bigger problems? So I think there's a lot to be learned from this, and I still have a lot of learning before I can really be able to speak intelligently on all of this and really be able to apply it really well. So it's going to take some practice too. Road ahead. We've had several meetings with about the IRIS software system, the Integrated Referral and Intake System, and in my next update at the end of the year, I'll have a lot more information for you on that. But that'll help us and help a lot of the agencies with this interconnection between us and communication between us. Looking at implementing strategic thinking into our operations, and then continuing to build and maintain our community partnerships, just like these that I've listed here. And are there any questions at this time?
Not for me, anyway. You pretty well covered the action over there. There's quite a bit of it. And utilizing everything, so it sounds like a job well done.
Thank you.
Any other comments from commissioners or questions? All right. Well, thank you, Jason.
Thank you, Jason. Good deal.
That brings us to the item number 17.
RFA number 164-19, Architectural Services Request for Proposals Invitation. Andrew Manley, County Administrator.
Mr. Manley, let's hear from you.
Good morning, Chairman. In front of you is an RFA to extend invitations to architectural firms to proceed in the RFP process. So I'll start with a little history. On April 30th, the Board of County Commissioners charged staff to begin the process of bringing an architectural and engineering firm on board to assist the Commission in evaluating the jail infrastructure options. The Commissioners felt that an AE firm, architectural engineering firm, could bring a fresh perspective, additional information, and potentially new ideas for the Commission to consider as they discuss infrastructure options. On May 22nd, administration sent out requests for qualifications, or RFQs, for the purpose of securing AE firms and appropriate consulting services for a potential jail infrastructure project. The goal of the RFQ step was to qualify a short list of firms to move on to the request for proposal phase, or RFP phase. At the conclusion of the RFP process, an architectural engineering firm will be selected as the lead firm, assisting Saline County Commissioners in evaluating the multiple infrastructure options. I do want to emphasize that the core responsibility of this firm is to evaluate Saline County's multiple potential infrastructure options. So on July 16th, 2019, the Board of County Commissioners heard 4 architectural engineering firms present their qualifications. These firms were then interviewed that afternoon by the Jail Committee. Members of this committee included Chairman Vidrickson, Commissioner Shadwick, Sheriff Roger Solden, Under Sheriff Brent Melander, County Administrator Andrew Manley, Deputy County Administrator Hannah Stambaugh, Community Corrections Director Annie Grievous, Citizen at Large, and former Administrator Rita Deister, and our consultant Jim Robertson. They were evaluated on 5 categories of evaluation criteria, being which experience and capability, past record of performance, ability to perform the work, capacity and capability, and experience with government. Each category had variance of potential points. After analyzing each proposal and presentation, I, as the county administrator, have scored each firm with the results as follows. Trainer getting 99 of an available 100 points. Shive Hattery also getting 99 out of an available 100 points. BG Consultants at 86, and HMN Architects, again, 86. It shall be noted that each firm did an excellent job presenting, and that the above scoring results shall not be construed negatively on any of the firm's prior work. The largest discrepancies between firms were in the areas of recent experience completing like-sized and similar scope and ability to perform the work. Again, the above rankings is a discretionary opinion derived from the submissions from each firm, the public presentations, and the private interviews. The alternatives for action is to extend an invitation to Shive Hattery and Trainer HL. Also extend an invitation to just one firm, also any 2 firms, any 3 firms, or to all firms or other. It is the county administrator's recommendation to extend invitations to Shive Hattery and Trainer HL to participate in the request for proposal phase. There will be no budget impact during this phase. Services and staffing will be maintained at full expectations.
All right, well, I can tell from our audience's response that we're not as important as the baseball games on this thing, for sure. Had a packed house here last night for the baseball decision, but the jail is not on the radar screen, evidently. Nonetheless, my personal opinion is that we should follow staff's recommendation, and that is to extend the invitation to Shive Hattery and Trainer. I think that gives us 2 options to listen to, 2 prices to potentially consider, and both of those firms throughout the day were very professional, and I felt like I'm at this stage of the game anyway, not hearing any more from those people, that I would be extremely comfortable with either one of them. So, and they did, without question in my mind, separate themselves from the other 2 firms for this process. So, that being my opinion, I will let the others state theirs.
Mr. Chair, I agree with you. Those 2 definitely rose to the top. I was especially, and for the 2 commissioners that weren't there, I was especially pleased to see past designs that they have done to help reduce populations. And you can design a jail for that. Instead of just designing a jail as just to house inmates, the way that they had done some of their past ones enabled programs to be done. And so I was particularly pleased with that, and I felt that those 2, they were clearly above the other 2. And again, echoing your comment, not that the others were bad, it's just their past projects really impressed me. So.
Okay, other comments? I guess I would, because this does include an RFA, is there any public comment?
Northern North Carolina. Where's Trainer from, Andrew?
Topeka.
That's the one we need. That's the one we need.
All right, at this time, I'll bring it back to, there's no one else in the audience, so there won't be any other public comments, so, well, she's an employee.
One final comment, though, Mr. Chair, is some of the other commissioners might want to, why are we doing 2 instead of just 1? And I think a comment that was brought up during that meeting is that would make the bidding process a little bit more competitive. Instead of just the 2 of us kind of deciding which is the number 1, we'd like you to be part of the process there, and I think we'll get a more competitive bid.
And to expand that just a little bit, I I think those competitive bids will be pretty close. That'd be my guess. I mean, they've been in this business a long time, and I'm guessing from a number standpoint that they will be pretty close to one another. So the next stage of this process, which, by the way, it's my understanding will include all 5 commissioners.
That is the intent. We're
That
still
is
working on the
intent to
agenda and
include
the structure.
everybody.
Yep.
I mean, that's been my intent on this, once we get to this stage, to have all the commissioners informed and voting on those things. But I, too, believe that the 2 people are the ones to invite. So if the other commissioners have any opposition to that, I mean, I'd be willing to listen to it or support of it. So that having been said, I will take a motion.
Mr. Chairman, I move we extend invitations to Shive Hattery and to Trainer HL to participate in the RFP phase as recommended by staff.
Second the motion.
It's been moved and seconded that we approve RFA 164-19 Architectural Services Request for Proposal Invitation. I might add that I think we're looking at August the 16th or 13th. What was it?
August the 13th, it's a
August the
Tuesday.
13th.
We'll discuss that a little bit further in study session, but
Okay,
that's
which is also a Tuesday, I think, by the way. So, all right, it's been moved and seconded on this proposal. All those in favor say aye.
Aye.
Opposed, same sign. The motion does carry. That brings us to the end of our proposed agenda today. Under other business or announcements, I know that last week we got notice from FEMA, the Federal Emergency Management Association, that the agency, that they wanted to meet with our officials regarding the flooding issues and so forth and what they're going to do for us. I was out of town, unable to attend that meeting, but I know that Commissioner Weiss did attend the meeting, I think along with Hannah Stambaugh and others within our organization. And so I would ask Commissioner Weiss to give us a thumbnail sketch of what went on.
Well, yes, FEMA did meet with, and it was, the meeting was ran by Kansas Department of Emergency Management, and they're taking the lead role and being the contact between FEMA and the counties. I think there was 77 counties impacted by the flooding. I think that's the number. And they're having to touch each one of those counties and set up this program. And they just outlined how you go about applying for reimbursements, what those reimbursements might look like, what reimbursements can be paid and what can't, and how that will be coordinated. And I believe our Road and Bridge, being the largest player in this, is taking the lead role and making the application, and then other departments will piggyback on Road and Bridge and put their information into their packet, because you can only have one come from each entity. The city will be doing their own, and I believe their Park and Rec is taking the lead there. I'm not sure what they finally decided, but it's a long process, but I think we'll have good results for the county as far as getting the majority of the money spent because of the flooding reimbursed back through FEMA, and also 10% through KDEM. So we'll see going forth how that works.
Correct me, Mr. Manley, if I'm incorrect on this, or Commissioner Weiss, but I think the threshold was like $3,200 per project that you have to have at least that. Is that the number that I heard from Hannah?
Once you hit the threshold, and the way I left the meeting believing that if Road and Bridge FAR went over the threshold, so any liabilities that the Sheriff's Department might have had as far as overtime and this and that can piggyback on that, and they don't have to reach the threshold as the Sheriff's Department. Just Saline County had to reach that threshold, and then all the different entities that would be in that one application could apply for reimbursement.
Well, I know that as of, I think it was last week, that we had nearly $500,000 in expenditures for flood repair. So That's,
coming, yeah.
and more coming, that's exactly right. But they are making headway and doing it pretty rapidly, and I'm pretty pleased with the Road and Bridge Department and how they're progressing and so forth, so. Okay, I also would announce that I attended the Airport Authority meeting last week. I think the big news coming out of there is the upcoming Jaded Thunder exercise that will be here. I mean, that's like a 5 or 6 week process for all the training that comes in. They book up nearly every single hotel room in town. There's not a rental car to be had. I don't know how many thousand people that entails, or nearly 1,000, whatever, but it's certainly a big deal, a huge economic impact on Salina. And as I understand it, if you're interested in watching some of this exercises, most days their exercising starts at about 3 p.m. is when they get the planes revved up and get those things going. So it's pretty intense and interesting to watch at the airport. So. And I believe that starts the first week in August, I believe is when it goes. So any other announcements or questions?
Just to bring up the Tribe Rivers Fair coming up in the second week in August there. So, and we do have, it's the first year that the Tribe Rivers Fair will have a country and western singer, a band, Deanna Carter, on a Saturday night. So looking forward to that. And so I think they have the standard rodeo and the Demolition Derby also, so come out and visit that. Thank you.
Anything else, Mr. Manley?
I do not.
Okay, that having been said, I will take a motion for entertainment, a motion for adjournment.
Second.
It's been moved and seconded that we adjourn. All those in favor say aye.
Aye.
Aye. Motion does carry. We are adjourned. We will have a second study session after a short break.